We had interesting presentations for him. So Dr. Shuaib is a professor in the Department of Medicine, Director of Stroke Program, Division of Neurology, University of Alberta, Canada. He completed his residency in internal medicine and neurology, University of Calgary. He completed special training of cerebrovascular research at University of Western Oriental Canada, Duke University. He's a chair of National Stroke Program, National Resident Review course, is on the board of the Canadian Stroke Consortium. He's gonna to talk to us today about brain health and stroke. Thank
you. It's getting late. I want to know who picked that topic. It's you know, I've done teaching most of my life, and I can tell you that the person who presents gets to know more about a topic than anyone else. So I didn't know much about it, but I do know a bit more. There's no conflicts. This is interesting. So I was getting ready to make my presentation, and I wasn't sure, what am I going to talk about? So then I see this, 6 things a neurologist does to keep his brain healthy. So that's great. And just under the title was this picture. I looked at this and I said, this has got to be accidental, right? They just put it there by mistake. But it makes sense, right? You need to be outdoor, you need to be exercising, you need to use that brain of yours and be scared. All those things are very helpful. But this fellow who's a neurologist came up with these things, and it's very interesting. The sequencing is very interesting to me. So talks about healthy diet, and I'm going to come back to that. Exercise, challenge your brain, sleep well, and have a purpose in your life, and meditate. So Peter Rasmussen was talking to me earlier yesterday and said he's going half-time, going to go into being a half-time member here at the faculty. And I was asking him, what are you going to do in the other half? Because I can't imagine doing half-time. And that's the purpose in life that becomes really important. So I've been thinking, could I be a good sailor? Well, I love it when somebody else you're sitting in a boat and it's sailing out there. Well, I don't think I could do that. So I'm still struggling for my purpose in life, honestly. So here's my objectives. I believe that the best window we have that no other specialty has is imaging and looking at the brain and looking at silent white matter changes. I mean, as soon as you start seeing those, it's like, so it's a window of how your brain is healthy or not healthy. So let me put it the other way around. If you're 70 years old, which is what I will be in a few months, and if I have a brain that's pristine with no white matter changes, no microbleeds, that's a healthy brain to me. So I think we have that opportunity. So I'm going to talk about the white matter changes. And then I won't spend too much time on risk factors, but there's one that I'll spend a little bit of time on that's gotten me very excited. It's about a paper that got published in April in Nature. I mean, I get excited about things, but this one really got me very interested. So I got these definitions from 3 different sources of what is a healthy brain. And the one I like the best is the very bottom there. So it says it's free of chronic conditions, such as inflammation, environmental exposures, sleep quality, and the gut microbiome. So all those things that neurologist was talking about in, the guy who's running away from the bear, those are the important things. And I'm thinking, I'm going to make a story for you, right? And as I'm thinking of a story, this comes out. This is so interesting. So this is in stroke. Oops, I went up a slide, I think. I want to go back. This comes up, and it says brain health across the lifespan. Beautiful article. It just nicely looks at a whole bunch of things. So, inflammation is right there, pollution is right there, sleep, microbiome, and for some reasons that my esteemed colleagues here don't know, the time is frozen. I still have 15 minutes left. Well, says no. So I've another 7-8 minutes. I'll be done. So this is really important. So this comes into all the factors that are really important. And when I talk to my students, my fellows and residents, it's not at my age that you should start worrying about these things. It's actually when you're in your 30s and your 40s, and especially if you haven't fixed those things by the time you're in the 50s, it's already too late then. So chronic inflammation, really the subacute chronic inflammation, which is the big deal these days, starts very early, and that's where I'm going to head. So this is a good segue into what you want to. If you want to know about brain health, pick this up. I think it's still in the phase where it hasn't reached the printed edition, but it's available online in the journal Stroke. And this works very nicely with what I consider to be some of the best primary prevention strategies. So these are not just for stroke, but for heart and peripheral arterial disease and renal disease and everything, right? So in here, what I wanted to draw your attention to, so all of this is straightforward and simple, but I want to talk about these two things. I spoke about hypertension earlier on and how important hypertension is. But I look at the risk reduction and compare hypertension, which is the second one, to a healthy diet. I think that is one of the most important ways that you want to keep your brain healthy. And in some of the developing world, it's worse than McDonald's. I mean, they have, where I come from originally, from Pakistan, ultra processed food. So they have what's called samosas and pakoras and all those things. That's terrible to your health. And so what they've done in this cohort of the MESA study, and most of you are aware of this, these are 6 counties across the US, in Baltimore and Chicago and Los Angeles, where they've looked at these very large population of disease-free individuals, and they've been following them for years and years. And so this is earlier on this year, where they looked at, can you if you eat processed, ultra processed food versus if you don't, and you look at different quartiles, those who are the best, the Mediterranean type eaters versus those who are horrible eaters, there's a 66% relative risk of developing heart disease and stroke. So it is very important that one teaches and practices ourselves. In my hospital, right across from the hospital, there is a place, they've named it Vegas Donair, and they make the best wrap. Almost every second day I'll end up going there and eating one of those. But in the last year, I've just switched totally to the beetroots and carrots and adding avocados and things. In fact, I was sitting with some people and telling them how I switched my diet, and they couldn't remember my name, so they were talking to somebody else. He says, that Dr. Beats, it is really important that we start changing these things. And it's not just in the MESA study, but this is almost identical, much larger study out of Europe, again published in 2026. So I wanted to start off with, what a healthy brain is. But what keeps my clinic, our stroke prevention clinic, about 20 to 30% of our patients, this is what comes to us, right? This is a radiologist who reports on a CT scan and says it's small vessel disease, right? And this family doctor just sends them over to us. It's kind of too late by then, right? So by definition, it's a broader, quite a broad definition. So you've got if you talk about small vessel disease, is evidence of subcortical infarcts, lacunes, white matter hyperintensities, microbleeds, and if it's really bad, you can get to superficial siderosis, and you've got all of these. And in that definition, the microinfarcts weren't there, but they're also very, very common. So if you have this, if you've got white matter disease, the most recent meta-analysis, the big meta-analysis, will tell you that your risk of stroke increases by 2.5%. Your risk of ischemic stroke is right there. ICH is even higher. One of the commonest cause, in fact, is white matter disease. You increase the risk of dementia and also early death, right? Very common. And so white matter disease is unhealthy. And if you look at the risk factors, all the conventional risk factors, I don't need to go into them. I have been very interested in these things personally over the years. This is a slide I'd made some time ago, quite 2 or 3 years ago, but it still holds true today. I intend just speaking about inflammation today, but environmental pollution, social isolation and loneliness, and people would add hearing difficulties, lack of sleep, the microbiome. There's a lot of interest in periodontal disease, sleep apnea, and Fahad was talking about his data with little a, and even triglycerides can increase the risk. So inflammation, and I get this iPhone sends you all these things, right? So I was just showing Kasim at the back that as I'm preparing this presentation, this is what's happening in the lay media right now. So this is number one sign for chronic inflammation is fatigue. Here's another one. So that was in 26th of May. Here is the Vogue talking about a week ago that these symptoms are non-specific and widespread and include a whole bunch of stressors, and fatigue comes up again. Here is the Daily Telegraph from last week, again talking about how important chronic inflammation is. And if you don't believe some of this lay press, here is Scientific America last month says that 40% of times the classic risk factors do not identify what the etiology is. They believe, and it's a beautiful article talking about where chronic subacute inflammation comes in. I found this, my personal interest goes back to almost 7 years ago when Nature Medicine published this paper. I haven't seen a better presentation on chronic inflammation as an etiology for atherosclerosis. And if you look at it, they talk about all these environmental factors that I talked about, and then they can lead to multiple diseases. And so if you look at these risk factors, I'm just going to enlarge this for you. All these physical inactivity, obesity, etc., they lead to a whole host of conditions, and they're calling it sickness behavior. So that chronic fatigue that I was talking about is at the top of that, and altered sleep, and social behavior that's sadness, etc. And then all these other things kick in: hypertension and diabetes, and insulin resistance, etc. What I wanted to end my presentation was on this paper that I found absolutely so interesting. So this is in Nature, so not Nature Medicine, their flagship. It came out a month ago, and it's just amazing work. So they looked at two very large cohorts. We all know about the Framingham study, and the other one was what's called the National Lung Screening Trial, which has 25,000 people in it. And what they were looking at, because there was a whole bunch of emerging research on thymus and chronic inflammation. So they created this automated software, and they looked at all these individuals who'd had CT chest for whatever reasons, and they looked at their thymuses. And so they put them into 3 categories. The one on your, what side is that? The one that's normal is on your left, and the one that's absent is on your right. And so approximately 50% of patients were in the middle. There were 25% who had a good thymus into their adult life. So these are mostly individuals in their 50s, 60s, and 70s. And they compared the mortality over 12 years. And they were able to show that those who had a normal thymus, about 12 to 13% of these people had died, compared to 25% in those in whom the thymus was missing. And the reason why I'm here showing you this data is this part, which is the cause of death. And when they looked at cardiovascular disease, which included stroke, you can see that both groups, so the A is that longitudinal lung study, and C is the Framingham data, that you can see that those who have a normal or high thymus, you can see the difference between those and those who have the low thymus on imaging is a massive difference. Even when you correct for age and smoking and all the other vascular risk factors. Is it a causation or is it association? All these things are very, very interesting. What about white matter changes in the brain? Yeah, that's what we want to do. So we'd like to see if I've already been asking some friends at Framingham, because they have those MRs. They've already quantified those white matter changes. So we don't know about that. But certainly the link between the thymus and chronic inflammation appears to be very strong. 23 seconds. Let me just end my presentation with what do you do about it? Can we slow it down? Can we prevent? I mean, it's all about vascular management of these, a whole host of things that I've shown you there. We can not prevent it, but we can slow it. What do the guidelines tell us? The European guidelines say we could use aspirin, but there's no data that it'll slow things down. The American guidelines, the most recent one from 24, also are saying the same thing. There's no benefits of antiplatelet treatment, but you may end up using it. So at the end, basically, it comes to these things, right? How do we look at all of these, and how do we improve our lifestyle? At my age, it becomes a little difficult making slides, and I made them all myself, but this is my most important slide for you. How do you change behavior? So I've taken these, don't take that processed yogurt, make it yourself, the clean one, add some fruit to it. Don't eat chips, but have those nuts. That processed tomatoes, the one that you get with Campbell's, has so much additives in it. These cut tomatoes that are much more important. And if you have to eat proteins, take the good one and not the bad one. And I've shown you examples there. So if I conclude now, vascular risk factors are very, very important for your brain health. A third to half of cognitive vascular changes contribute to dementia, and a lot of that's preventable. The small vessel disease, cerebral, is a marker, and it's an important marker. And as long as we can manage all these host of risk factors, sleep well, eat well, exercise, I think you can slow it down. So that's where I'm going to end my presentation. I'm a minute and a few seconds over. I'm sorry for that.
Thank you so much, Dr. Shuaib. We have questions. Do we have questions? Yeah, we can get one question.
Thank you for this great presentation. There's emerging national pandemic predominantly on microplastic, and a lot remain unknown about the impact of microplastic in the area of vascular neurology and stroke, but it's really becoming more knowledgeable about what's its impact on brain health. As a matter of fact, there was a pretty alarming paper published in Nature just a few months ago that quantified the amount of microplastic in the brain. So what's your comment on that and potential future area in vascular neurology and its impact microplastics?
Yeah, that's an excellent comment. I was at a conference that FAHA that organized in Riyadh, and that was the week when this New England medical paper had come out. And it's one of the very few times when case reports make it to the New England Medical Journal. And they basically shown that patients with asymptomatic carotid stenosis, if they looked at the plastic content, there was a 4.5 times more likelihood of having a stroke in individuals who had plaque filled with plastics. They stimulate attraction of microglial macrophages, which causes inflammation. And yes, the paper in Nature Medicine is also very interesting that in patients with dementia, the microplastics were above, when they were making those graphs, they were just above the multiple fold more than in people who had normal cognitive function. So microplastics are dangerous, really dangerous. I agree. I mean, in fact, most of us have changed all the things you can do is take away those plastic containers, put glass containers, those spatulas that you change, those plastic ones should be gone. I mean, there's a lot we can do to slow those things down. So thank you. That's an excellent comment.
Thank you.
Thank you, Dr. Shuaib. Thank you. So let's move on to the next speaker, Dr. Mann. She's going to talk to us about disparity in stroke care. Dr. Mann is a staff neurologist and associate professor in the Center of General